Hi, welcome back. We're up to part 3 now on sciatica. I'm Chip Mosley again from Total Motion Physical Therapy here in our Raleigh, North Carolina clinic. Today we're addressing a common question that we get not only in the clinic but even on the phone before people call us up to decide if they're coming to therapy is, if I have these sciatica symptoms, do I need surgery or would therapy and more conservative treatments work for me? How can I know? Obviously, a lot of people are not necessarily surgical minded. The invasiveness and the cost and so forth that goes into that might not be the way that they would choose. And there are several surgical minded people out there who say nothing will ever be fixed unless you cut on me. So how can you know? What does the research say? Well, New England Journal of Medicine and WebMD both came out with some interesting findings not too long ago, saying that first of all, if you are a surgical minded person, they called surgery what they call an elective, meaning that it wasn't urgent. And if you were to delay, when you have those symptoms, if you were to delay a period of time to see what would happen, typically more often than not in their research, things weren't worsened through delaying it. So if you're considering surgery, you might not necessarily have to jump on that horse right off the bat in your first week. You can give it a little bit of time and see if you have either time or conservative treatments like physical therapy. Maybe that might work for you. So that was interesting. Another study that kind of was related to this one out of the Netherlands was also finding if you compare the speed of recovery of someone who had surgery to someone who went to more like a physical therapy, conservative type of treatment, they both had pretty fast results when they were addressed in treatment. You would think of the surgery one would be faster because you go in, you cut something out, you come out, it's gone, right? But if you actually look at the speed of recovery on that, they were both put into the quick recovery category, which is nice when you're dealing with someone who knows how to address it. And if you look at the 1 year later results, they're actually in similar categories as well. So in many cases, you can maybe have just as good a response non-surgically as you did with surgery, if you're leaning that way more so than others. So that's a factor. What percentage of the time do I need surgery? What does the literature say about this? Well, if you look at a lot of surgeon literature, and I spent a lot of time looking at a variety of surgeons all around the country trying to see what most of them would say, the conclusion I was getting from them is on average about 10 to 15% of the time, surgeons would say, that when you have this sciatic symptom, that I should go ahead and have surgery on this person. Now, you also have to keep in mind one thing. Surgeons do surgery, and that's what they do. They don't do other stuff, typically. So they're going to be a little more likely to maybe think that way than maybe someone who was not. So let's say you ask people who are not surgeons, what would they say? Well, I had a hard time finding hard numbers when you compare the different possibilities of surgery versus therapy versus other types of conservative treatment as well. But one thing I did see when you look at literature of a lot of different types is just the word most. They say most will get better with more of a physical therapy, conservative type of approach and not need surgery. But I didn't really see a whole lot of hard numbers as to what that might mean. So I guess you can say the consensus is greater than 50% of the time, people will get better per literature and not need surgery from these type of symptoms. Now, I will tell you this, our specific clinic stats, we have what I call the 90-98% results for sciatica. What that means is if you include every single patient who walks in the door, including the most compliant people who show up for all their appointments, do all the exercises we ask, and those people who you have to pull their teeth to get them to do any kind of treatment, they don't show up for all their appointments and things like that. What we find is those who did not complete their therapy, they showed up and did some of therapy but didn't continue the whole prescribed treatment that was set out between the physical therapy and doctor, we're still averaging in our clinic around the 90% better category. In other words, 90% of our patients were getting better even if they weren't great patients. They included the not great patients with the good ones. However, if you sifted them out and only included the ones who came for all their prescribed appointments and saw their therapy all the way through, 98% of the patients we saw were actually very happy with their result and were kind of treated and fixed from that. So those are certainly our local findings that we're seeing here, which are very good. What are some signs, tests, red flags that kind of tell us maybe these people kind of might be more surgical rather than therapy? Well, obviously as therapists are trained to look for certain things in clinical findings that'll flag us to that I won't necessarily go into a huge amount of detail, but one of the most commonly seen ones, if you have what's called a positive leg raise test, meaning if you're sitting down, for example, you pick up a straight leg and bend the toe back a little bit, If that zings pain all up your sciatica and into your back when you lift it on one leg, and if you do the other leg and it also zings into your sciatica symptom and up your back, even affecting the opposite leg, that's not a good sign. That typically implies things have progressed a little bit further. If you have things like bowel and bladder control issues that are going along with your back pain, or other type of medical concerns that are going along with your back pain as well, these are not positive findings that might imply maybe this person might need surgical, more than conservative treatments. Also, too, to me, my biggest one in many ways, if I ever have somebody who's wondering, I say, come on into the clinic for one appointment, or maybe even 1 week or something like that. The inability to make improvement when treatment is tried, to me, is the most obvious one that says I need to send this person onto a surgical thing. So often people come in for one appointment, I'll tell them, don't schedule anything beyond that as of yet. Let me take a look at it, and if I see certain things and we try treatment and we can't change you, that might lead me to be more likely to say, let's go talk to the surgeon over here and see what they think about things. Lastly, as I tell people, trust results. Trust when changes are happening. If you see you're going through treatment and you've been through several weeks of conservative treatment and you're still seeing things are getting worse, trust that. Even if someone's telling you, I got this and so forth, if you've been there for several weeks and you're heading in the worst direction, it's probably going to continue that unless something changes. Einstein's definition of insanity. On the flip side of that, if you see yourself getting better, and then someone comes in and says you have to have surgery, trust that too. I had a really painful discharge a couple years ago of this lady who came in for 1 week of therapy, could barely walk into our door on the first day. She was in so much pain, hunched over with her sciatica, but was being told that she needed to have surgery, but it was going to be a week until they could meet with the surgeon. So they were just trying to come to therapy to see what we could do, if we could make them more comfortable. Well, in that 1 week period of time, we had 98% resolution of their symptoms. That's what she was reporting as my patient, and in the clinic, as a clinician, I saw the same type of things. 98% better in 1 week. But she went and had her doctor appointment. I got a call the following Monday after that weekend was over, and the patient said, well, my doctor said I need to have surgery, so I guess I'm going to have surgery, but thanks for all your help. Bye. Click. And I fell off the phone onto the floor stunned, because this person in just 1 week of conservative treatment got that much better. Imagine if they had completed their whole course of therapy, how much good they could have been. But they went and had surgery just because someone told them that they should. Watch out for that. Trust your body, trust your symptom. Your body's pretty smart. It'll tell you if you're heading in a direction the right way or not. Hopefully that was helpful. We'll go into some more details in the next several weeks, but if you have any questions, call the number at the end of this video or email me. It's fine, and hope you have a great day.